My name is Matthew Certain. I'm a cardiologist here at Southeast Georgia Health System in Brunswick, Georgia. I got fully vaccinated in December of 2020. Being able to get a vaccine meant that I could protect my family, my friends, my coworkers from getting this horrible disease. This disease is absolutely ravaging this country and this world, and all of us getting vaccinated is the single most important thing in our health right now. It takes precedent over a lot of other things, and there's no way that we are getting out of this scenario until we get vaccinated. You can pick if you want the disease or you get the vaccine. Right now you have the luxury of picking. That is not the case for a lot of people that have already died or were seriously ill from COVID, but right now you have the choice. It is in your hands. You can either pick the vaccine or you pick the disease. And if you wait, you are picking the disease. If you get COVID, you have a 1 in 1,600 chance of death. 1 in 1,600 chance. That is a very high risk of death. You have a 1 in several million chance of having a complication from the vaccine. So you're really playing the odds. 1 in several million versus 1 in 1,600. In the large randomized trials comparing the vaccine and following this COVID illness, it is very, very rare. We're talking 1 in several million chance of getting a myocarditis from either the vaccine or from COVID. So it is not common and not something that I would personally be concerned about or that I would worry about if I was vaccinating one of my children over the age of 12. The biggest myth that I see is probably that this was fast-tracked or that there's not enough time to follow complications from having a vaccine. Let me just tell you, the vast majority of complications from vaccines, the things that in other trials when we were bringing other vaccines to market, usually appeared within the first 6 weeks. We're at least a year into this. We've been vaccinating people really in the clinical trial since late last fall. We would be seeing those now, and we're not seeing any of those problems from vaccines. This is a standard vaccine. It's an mRNA vaccine. It's a vaccine that we use commonly. We've been giving kids vaccines, the standard MMR, tetanus, rubella, Gardasil, meningococcal vaccine. This is just like those vaccines. This is safe and effective, and it is the only way that we are getting out of this.